Welcome back. Many Americans have reported symptoms of what health professionals are calling long COVID. However, for Black women, these symptoms often go untreated and ignored. Joining me to discuss her experience with long COVID and the support group she created in response to racial bias in the healthcare industry is social epidemiologist Dr. Margot Gage Whitfleet. Doctor, thank you so much for joining me.
Thank you for having me.
Now, can you first tell us a little bit more about long COVID? This is actually my first time hearing this term.
Long COVID is a term given for people who contracted COVID, but their symptoms lasted longer than the average, about 2 weeks. So it's lasting for months and months and months and never seeming to really go away after the initial acute infection.
Now, I know that many people refer to those with long COVID as long haulers, but in your TEDx talk, you actually mentioned why you're not fond of the label. Can you explain why?
I'm not fond of the name long haulers is because the term implies that we're in it for the long haul, as though it's never going away. And also, when our nation experienced polio, for example, before the vaccine was in place, the people who contracted polio, they just had polio, and the ones who had long-term complications just had long-term complications from polio. We didn't call it long polio. So I'm not into a name that means that I might never recover.
And I like that you mentioned that because I think that we often learn a lot that you shouldn't identify somebody as something that they experience or they're dealing with because it's not part of their identity. So I'm glad that you mentioned that. Now, despite COVID being a huge concern in healthcare, why are some patients experiencing neglect when they report these prolonged symptoms?
I think that COVID was politicized early on in the beginning. As we heard yesterday, I believe, President Biden coming out saying that the pandemic is over. So COVID is still being politicized. And now Dr. Fauci is speaking out that that's not exactly what President Biden meant with his words. So a lot has to do with the fact that we're divided. So we weren't able to get on the same page early on about how to fight this pandemic.
Now, according to NBC News, Black people in America make up the majority of long COVID hospitalizations. Why do we continuously see this pattern with Black Americans that we're often, part of the group of people who are experiencing the worst health outcomes?
So even before COVID came into the picture, socioeconomic problems and disparities was an issue in our country. So we have an inequality in terms of the rate that Black Americans contract illnesses. So this was a problem long before COVID. Our diet, our weight, things that in terms of health was a large problem in our community before this even happened. And COVID just exacerbated this issue, really shone a light on the health disparities, like just with not having health insurance at the same rate as mainstream society, things of that nature. And then not only that, when we were the bulk of the frontline workers, especially women. That's something that we really don't think about. When we think about frontline workers, you might think about the doctors, but think about the people, the janitors, the people who clean the hospitals as well. Those are typically people of color, women of color. And so they got hit with this virus early on and brought it back to their communities.
Now, I was shocked to read that even as a highly educated health professional, you also experience having your health concerns dismissed. Can you just tell us a little bit more about that experience?
I was shocked about that too. Not shocked in the sense because I knew the statistics. I've read about it in my work. I knew that having a baby in America as a Black woman is a very dangerous thing. That's why I didn't have my children here. I had them overseas in Europe. So I knew these things. But when it was happening to me firsthand, I didn't expect that I would become basically a subject, one of these research participants that I had been reading about. So I was surprised myself when it did happen. But thankfully, I was able to advocate for myself. And being a health expert, I felt secure in what was happening to me and to be able to speak with doctors. I can only imagine what women who are not in the same position as me experienced. So I feel really bad for those people who did not have the tools or the capabilities to advocate for themselves.
And I'm glad that you brought that up because I know that a lot of people often think, well, if my doctor says this, then maybe I am just over exaggerating, or they tend to lean into that. And I know that a lot of people have just been saying that, oftentimes that is linked to racism in the healthcare industry. Can you tell me a little bit more about the history of that?
I think that's a long history in America. There is a lot of books on medical apartheid that you can read. A lot of what we progress we have made in gynecological medicine, for example, was built on the backs of Black women and the harms that came to them. So for me, I think it's unfortunate that doctors and medical staff bring their biases into the treatment room. And I do think that the medical community needs to move forward because we can't operate and have medical care for all if you're not able to drop your biases at the treatment door.
Now, I'm curious to know. I also, like I mentioned, that I watched your TEDx talk. You said that you were actually a very healthy person, and you didn't really have a lot of health issues, even though you did, have COVID. And you struggled with that. Did that play a part into why doctors possibly didn't treat you with the respect that you were expecting because they maybe had this misconception about your health before even actually knowing a little bit more about you?
I would like to say I had no prior health conditions whatsoever, not even some. I'd never even broken a bone. One of my doctors described me as being medically boring. I also didn't have a relationship with a doctor because I never went to the doctor. So when I presented in an emergency state, and the doctors would ask me first if I had taken something. So their immediate thought was maybe this woman is on drugs. And this happened not only to me, but to a lot of Black women who came in for COVID symptoms. Some of them even got security called on them. So I don't think it was just because I was healthy. I think that would be too easy of an answer because it was happening to so many of us. And I completed a research survey in my healthcare group. And I would say that this happened to majority, more than half of the women who responded to the BIPOC long COVID survey. So it's not just about me being in good health. But one thing that it did have to do with, I will say, is that early on, the CDC didn't have any idea about COVID like we have now. So because I never had a fever, that really threw doctors for a loop because the CDC guidelines said that I was supposed to have a fever or a really strong cough to have COVID. So that was one of the issues that started me down the rabbit hole of not being believed by doctors.
Now, I understand that your experience led to the creation of an online support group. Can you tell me more about that?
Yes. So my husband got me into the online groups early on because he found some in Europe that's where they had actually started. And so I joined into these groups and I started seeing women, like all women, irrespective of color, reporting that doctors weren't believing them. So again, a lot of these women had it was nothing to do with health. They just weren't believing them. And research shows that this happens often with women, especially when it comes to pain. When you compare a woman to a man with pain levels, that medical gaslighting is real and it does happen. And it's a pattern in the medical community. And so then when I started seeing Black women in particular getting security called on them, I knew that we would need to have our own safe space. So I started the BIPOC Long COVID support group.
Now, with the rise of issues like Black maternal mortality, many health organizations have made commitments towards addressing racial bias. Have you seen those efforts?
I think it's great. I support all of these efforts that are being made. I think we need more initiatives, definitely coming from the patient perspective. But I also think that it needs to be top down as well. And this needs to be systematically addressed in medical school curriculum because it's not being highlighted in the way that it should be in order to make real change. It's got to come from both places.
Now, the support group has changed and saved lives. Do you have any future plans as the support group continues to grow?
To continue supporting these women, bringing in experts to speak with them, and sharing my experience, strength, and hope from what I have done to improve my quality of life. And we have some experts in the group who are doing their own thing. We have other women in the group who are also doing their own thing. So it's not just me; it's a community effort, and that's what makes this group really dynamic. Is that we are able to get together and share our tips and tricks of what's working to helping us get a little bit better and a little bit more quality of life than what we have had for me for almost going on 2.5 years now of being sick with COVID.
Now, how can someone who thinks they may be experiencing long COVID join this group or find similar support groups?
There's support groups all over Facebook, so I would say join them because you're going to learn so much, and it's going to help you for when you go into your doctor's appointments to know how to communicate with your doctor and to advocate for yourself. It also might help you if you're so sick, because there's some people who are so sick that they cannot work. And if this is a woman, and especially a woman of color who is typically the breadwinner of the household, this has a severe impact on not only her, but also her children. This group also there's women in this group who are helping other women with their disability applications. So when we say a support group, we really mean a support group in every form of fashion of the word.
All right, doctor, thank you so much for joining me and sharing this information.
Yeah, thank you. You have a great day. Thank you for having me.
We'll be right back with more Open BxRx Tuesday.